This is the second part of Chapter 3 of Goodman, the Psychosocial Spiritual Impact on Healthcare. So, substance use and addictive disorder. Substance abuse is the excessive use of mood-affecting chemicals that are at potential or real threat to either physical or mental health. And 4 primary diagnoses include dependence, intoxication, abuse, and withdrawal. So, dependence, you're relying too much on that drug. Intoxication, you have excessive amounts of that drug that are causing your body to behave differently. Abuse, you're relying too much on that drug. And withdrawal, you're having a hard time to pull away from that drug. Common substances that are typically abused are caffeine, cannabis, hallucinogens, stimulants, tobacco, inhalants, opioids, and sedatives. So caffeine, that is the adenosine receptor antagonist, increase in responses in bilateral medial frontal polar cortex and right anterior cingulate cortex executive function. It inhibits the GABA and increases the glutamate, as well as decreases the cerebral blood flow. And caffeine is present in things such as soda, coffee, and energy drinks. Cannabis-related disorders. So cannabis is anything like marijuana, and it's considered a gateway drug. So basically, this drug could lead you to becoming addicted to more serious things. And in cannabis is the delta-9 THC psychoactive compound. The cannabis has a long half-life and development of tolerance, so it requires less of that drug for you to build up your tolerance, and you're going to be able to tolerate a lot more of that drug before you start noticing that you're changing. It stays in the system as long as 8 days, and it causes lethargy and lack of motivation. Hallucinogens cause an altered perception of the environment. And typically, for hallucinogens, this isn't something that a person's going to be using for a long period of time. They're usually just experimenting with the drug, and they just want to experience a sense of euphoria. They want to be able to get away from, their actual overall reality. But it can cause things such as rage, psychotic episodes, or suicidal ideations. Stimulants increase the glutamate excitation and increase activity. They also have a short half-life, so that causes a frequent craving and increases the psychologic state. Some things that can happen with stimulants are hypothermia, convulsions, and death. The thing about stimulants is that it has a high relapse rate, so somebody who pulls away from stimulants is going to be likely to use them again in the future. Tobacco is seen in things such as nicotine. That's considered a mild stimulant. It has a rapid increase in dopamines. It alters stress, arousal, and impulsivity, but it can cause cardiovascular disease. Inhalants alter the brain chemistry. They have lifelong damage to the nervous system, and they're present in things such as paint, gas, glue, nail polish, hairspray, and lighter fluids. They're more common in kids and teens, and so I guess things that they would be more common in would be your nail polishes, your paints, your hairsprays, but also I guess nowadays they're becoming common in things such as vaping. They do cause things such as temporary things as well as death that can occur during that first time use. Opioids happen. So for opioids, they bind to receptors in CNS, PNS, and GNI systems. They cause feelings of euphoria. They increase dopamine. The continued use will lead to withdrawal. Tolerance develops quickly. It causes overdose and death, and a positive prognosis in recreational use. So that's going to be somebody who doesn't abuse opioids. They're going to be the person who's more likely to be able to get away from an addiction of opioid use or negative effects. Sedatives increase GABA, sedative effects on brain. They cause drowsiness, perceptual changes, and motor impairments, and they increase the amount of motor vehicle accidents. Driving and intoxication. So new users of opioid analgesics have impaired driving skills. Alcohol is the most common problem of driving and intoxication. Chronic alcohol use causes liver damage, cognitive impairments, peripheral neuropathy, chronic pancreatitis, cardiomyopathy, myopathy, and certain cancers. For smoking cessation, cardiopulmonary system is usually compromised, and 5 years is lost in somebody who smokes compared to a non-smoker. Quitting will reduce the risk of cancer, cardiovascular disease, or pulmonary disease. Injection drug use. They increase the overall rate of skin and soft tissue infections from the unsterile intravenous and subcutaneous injections. Simple cellulitis, neurotizing fasciitis, and septic thrombolytis are common issues that can happen with that injection drug use. I guess because the things are unsterile, this causes an increase in the amount of infections that can happen. For delirium, these are a cluster of signs and symptoms. Acute changes in attention and orientation to the environment occur suddenly, usually within a few hours. Symptoms fluctuate throughout the day. They worsen late in the day. They can elicit fear and distressed emotions in clients and caregivers. Older adults are at greater risk, and temporary use of delirium is something that's common. It usually goes away when underlying conditions are resolved, so it's not going to last for a long period of time. And suicide is more common in males than females. The highest are in people who are younger than 25 years and white men who are 80 plus. Personality disorders. So you have bipolar disorder, avoidant, OCD, schizotypical, antisocial, and NPD. Borderline personality disorder is the instability of identifying interpersonal relationships and mood. So you're not stable in the way that you interact with people. Avoidant people have low self-esteem. They're uncomfortable in social situations. They're overly sensitive to criticism. They avoid interpersonal relationships for their fear of rejection. Since they don't know how to interact with people, that causes them anxiety, and they're scared of how people will overall perceive them. OCD, they identify sense of worth through work, perfectionist, rigid use of how things should be done. So they want things to be done a certain way. And if something gets off of how it's typically done, it's going to freak them out. Schizotypical, difficulty with interpersonal relationships, odd personality characteristics that interfere with relationships. Antisocial person, they don't want to interact with anybody because they're more focused on themselves and how that they can gain the satisfaction from their self. They lack empathy, they're hostile, deceitful, impulsive, and aggressive. And NPD, they have grandiose, critical, and evaluation of others. They lack empathy, exaggerated sense of self-importance, demand special treatment with sense of entitlement. So everything has to be about them again. They don't know how to interact with people, and they feel like they're the most important ones. They feel like they're entitled to something. Chronic pain disorder is pain past the normal, healing tissue time more than 3 months, associated with depression and suicide. And that concludes Chapter 3.